Patients play an important role in a medical setting. It's important that patients understand the rights and the responsibilities when it comes to consenting to medical treatment and medical care. So today I would like for you to learn about the different types of consents there are. I would also like to cover the risk of liability that providers risk. Also, the exceptions to informed consent. There are times where you don't need to obtain an informed consent. And also government interference, where the government or the court orders a specific examination or treatment without the patient's consent. So I hope that you will learn those things today from my presentation. There are three types of consents that I would be covering in this presentation: express consent, implied consent, and informed consent. And I will be explaining them in detail in the next slides. Express consent is consent that is communicated through words. This consent is obtained either in written or in spoken form. An example of express consent is when your physician orders you to have an X-ray to rule out a fracture after you explain to your physician that you fell and you've been having a lot of pain on your foot. So then you would go to radiology and consent or agree to have your X-ray done. This would be an example of express consent. You are expressing that you want to have this X-ray done, or you are agreeing to have this X-ray done. Implied consent. This is defined as consent for medical treatment that is communicated through your conduct or some other means besides words. So you're not consenting this in words. You're using some other way of communicating this. For example, a physical exam. So as a patient, you arrived for your scheduled appointment. This is implying that you still want to have your physical exam since you did arrive for your scheduled appointment. Second of all, or the second part of it is during your physical exam, when it's being performed, you do not object to having this physical exam performed. So you never stop the doctor from performing this physical exam. So you're implying that you do want to have this physical exam done. And this is an example of implied consent, where you don't use your words to consent, but through your behavior, you communicate this. Informed consent. This type of consent is usually given after having a basic understanding of what medical procedures or tests may be performed, and the risk, the benefits, and the alternatives for those tests or procedures. This type of consent is usually obtained orally or in writing. An example of this is your physician scheduling you for surgery for a foot fracture. So your physician will explain the risks that are involved in having a surgery for a foot fracture. For example, bleeding, abnormal scarring, infection, and even death. The physician also explains the benefits, which could include relief of pain, no more discomfort, and to correct the fracture. The physician also includes the alternatives. So something else other than having the surgery for your foot fracture might be to wait and see if the pain goes away on its own, or to wait and see if the fracture heals on its own. So that would be an example of informed consent. This slide is about the risk of liability for providers. So providers who fail to obtain an informed consent prior to performing a medical procedure run the risk of liability for battery or negligence. Battery is often based on performing a medical procedure with no permission from the patient. This could result in liability because they never obtained that permission from the patient to have that procedure done. Negligence is often based on failure to fully inform the patient of the risks, benefits, or alternatives, resulting in harm to the patient. So if the provider didn't explain everything in detail, or they missed one of those, either risk or the benefits or the alternatives, and the surgery ends up harming the patient, then the patient could potentially sue the provider as negligence. There are exceptions to informed consent. In emergency situations, the law permits presumption of consent, whether the patient is an adult or the patient's a minor. Emergency situations are defined as a condition that possesses a threat to the patient's life or the risk of permanent loss of function. So, for example, if the patient is about to lose their life, or if the patient will end up brain dead, then those would qualify as an emergency situation. There's also a statute, the Good Samaritan statute, that protects different types of healthcare providers from liability for failing to obtain an informed consent, for rendering care to adults or minors at the scene of an emergency or an accident. And this is just to protect the providers from any liability, or a patient, or not a patient, but an adult or a minor trying to sue them because they did help them and they didn't obtain an informed consent. So this is just to protect the provider from that. There are times when the government has to take action. So they would be the ones ordering some type of exam or some type of evaluation. An individual's consent for medical exam or intervention is not freely given, then the government or the court can order it if they feel there's a need for that. There's also instances in criminal cases where the government is protecting the public, or they feel like they're protecting the public, so this is justified, where the individual does not give the consent and they would be subject to a medical examination or an intervention if the government feels that it's for the best interest of the public. Also in civil cases, cases where mental and physical conditions of a party is at issue. So for example, if the court or the government feels that this person is not in the right mind, or does not have the capability of consenting to something, then they would ask for that medical examination or intervention. There has to be a good cause for ordering it. So they really have to have documentation, and they have to have the reason behind it on why they need to have these things done. Also in mental competence, involuntary evaluations, treatments, and detainments if individuals are in danger of causing harm to themselves or to others. So if they're not mentally competent to consent to medical examinations or interventions, then the government would, or the court would consent for them. They would ask that they do those evaluations and treatments if they felt that the person was going to be harm to themselves or to others. So these are some ways that the government interferes with these consents. Does anyone have any questions? Anything that maybe they didn't understand or that I need to go over again? Anybody?